My name is Dr. Susan Bissett. I'm the Assistant Dean for Professional and Student Affairs here at the University of Charleston School of Pharmacy, and I want to share with you something that we do a bit differently here at UC, and that's a focus on interpersonal and communication skills as well as leadership. So you may know that there are three things that make a person successful in life. One of those is your IQ, or your intelligence, and believe it or not, we can test that between the ages of 7 and 12. And it pretty much remains the same over time. Obviously, you can't do pharmaceutical calculations at 7, but you certainly have the capacity for learning, and that stays with you throughout life. The other thing that helps to make you successful is your personality, and believe it or not, that's pretty well established by the time you're about 3 or 4 years old. So not much changes. So if you know a small child, that can kind of be a scary prospect. But the third piece that leads to success that can change and we can develop over time is something called emotional intelligence, often referred to as EQ or EI. And here at the School of Pharmacy, we're very committed to helping our students to develop their emotional intelligence so that we can ensure that you have positive patient interactions and positive health outcomes for those patients. The American Journal of Pharmacy Education has published several articles over the last few years that have spoken to emotional intelligence, and it's important in patient care as well as success in pharmacy school. In fact, a lot of the research shows that for pharmacy students, medical students, nurses, PAs, anyone in the healthcare profession, that the higher your emotional intelligence, the better your achievement or GPA, the better the patient care. In fact, your EQ matters much more than the patient's EQ, and higher job performance long term. So what we do here at the School of Pharmacy at the University of Charleston is we ask for you to self-assess your emotional intelligence during your very first year, the first few weeks here on campus. And then we work with you through our advising system. You work with a faculty advisor to develop those skills through your ePortfolio experiences. Those are co-curricular or community outreach experiences that help you to develop interpersonal skills, communication, leadership, all of those things that are important to interacting with others. And then we help you to assess those skills all the way through the didactic curriculum. And then in your P3 year, right before you go into your full-time rotations, your APPE rotations, or advanced practice experiences, we ask you to assess yourself again so we can see and you can see where you're at and where you might want to improve as you go out and into your rotation experiences. At that point, you're done with your didactic curriculum and it's about to get real. So you are with your patients full-time, you're working with a preceptor, and so those skills become even more important. So we believe here at the School of Pharmacy that emotional intelligence is just another piece to help you to be a successful student, but also to be a successful pharmacist in the future and to optimize patient care.